And I will start letting people in. Welcome, everybody. I have the Zoom set up with people to mute upon arrival. Can we just double check that you're muted? But if I could get a thumbs up to ensure that you can hear me, that would be great. Thank you, David. We'll just let a few more people in and get started quickly. We'll give it that other minute. Okay, we are all muted. I think we can go ahead. Good evening, everybody. Thank you for taking the time to be with us this evening. Welcome to our What is Muscle Activation Techniques lecture. My name is Renee Westmacott, and I will be your host. I am here standing by to assist you with any questions. I will start introducing Sarah Kuindersma. She is Active Sports Therapy's Muscle Activation Techniques Specialist. Sarah has been with AST, working in this role for 8 years. She actively works alongside other practitioners, making huge differences in her patients' lives. Her passion and knowledge are sure to impress you. If you have not had M.A.T, it will definitely leave you curious about how M.A.T can make a difference in your life. If any questions come up during tonight's lecture, feel free to write them into the chat box or raise your hand. I will be standing by to share the question when the timing is right. If you prefer to ask in person, feel free to stay on the call afterwards and you'll be able to ask Sarah then. Please join me in welcoming Ms. Sarah Kuindersma. Welcome, Sarah.
Hey everyone, thank you so much for joining me on a Tuesday evening. I really appreciate it. Today we talk about a topic that's very passionate to me, and it's movement. I feel like our bodies is what allows us to enjoy our life, and when we're being hindered because our vessel isn't feeling good, it really hinders how we're able to experience life. As many of you have witnessed, the better you're feeling, the better you're moving, life just becomes more enjoyable and it's just easier to do things. As soon as you've had an injury or chronic pain, chronic tightness, things that we love doing, like going for walks or going for hikes or picking up our kids or our grandkids, become more of a chore, and we become more tired and sometimes a little bit more cranky because we just feel really limited and restricted. And that's actually how I got into muscle activation. I had an injury when I was 12, and by the time I was 17, I just felt like I was broken. Like I was tired all the time because I was in pain all the time, and it really hindered my enjoyment of life. And luckily I came across muscle activation, and it changed my life so much that I decided to become a practitioner because I had to do that for somebody else to give them the freedom of movement. So that is what we're talking about today. As you can see in the screen here, hopefully you guys can see my PowerPoint, but it says, what is muscle activation? And so off to the left side, you can actually see 2 before and afters, and this is within 1 session. So you can see this guy, he has his knee flexion, it's quite limited. And then afterwards, when we've had our session, we've actually increased the range of motion. We'll talk about why that happens. And same thing with the gentleman in the bottom hand, you can actually see his shoulder range has improved. So what is muscle activation? A muscle activation is a treatment method that allows to make sure that your muscles are working well. So our muscles is what powers us to move, to walk, to put our cups away after doing dishes. And whenever there is something that's hindering it or stopping it from doing it, we lose that range of motion. So M.A.T is very simple. We check your range of motion, which we're going to get into in a bit. We do a muscle test, we do a muscle palpation, and then we retest to see where the range is. And we're going to come back to this slide a few times. This kind of gives you the overview on what we're going to look at. So what we do with the range of motion is the exact same thing that we do with our cars. So all of a sudden your check engine light goes on. What do? Maybe you put tape over it and ignore it, which sometimes we do. Sometimes we just ignore it, which sometimes we do with pain, or we decide to bring it into a specialist. And so with our body's case, it would be seeing a muscle activation technique specialist. So when this light pops up, it doesn't necessarily tell us what's wrong with the car, just that there is an issue. And so same thing with our bodies. Our bodies will let us know something is off by restricting our range of motion, then by getting tight before it stops the range of motion. I'm sure you've felt that before where you're like, oh, it just doesn't feel right, but like it's just kind of a little niggle. So I'll push through it and then it gets worse and worse and worse. And that's because we've ignored that warning sign. And then it has to get louder to say, hey, there's something that I don't trust here. We need to stop that range of motion. So it's kind of like a protective thing. So that's checking the range of motion. The next is a muscle test. What the muscle test and range of motion do is like the diagnostic tool for the car. So the check engine light goes on, you bring it to the mechanic. Again, with our bodies, you bring it to the muscle activation person to be like, hey, well, where is this issue coming from? And I'm going to show you an example here of myself getting treated. So here we go. So what's important to note there is that I said my right hip was getting tight when I was running. So that was just the complaint. That was the check engine light. It was just getting tight, not necessarily pain, but I didn't like how it felt, especially in my running stride. So next, what Stu is doing is he's actually looking at my range of motion and he's comparing me to me. So how does my right leg move compared to my left leg? And so this is the diagnostic tool, trying to figure out where is that issue coming from. So we're going to speed this up here because there is an issue with my hip extension. So I'll play that one more time and I want you to notice the left side compared to my right side. Now it was my right side causing me pain, or not pain, but just like discomfort, and it didn't feel very good when I was running. But it was actually my left hip extension that was limited. So I'm going to replay that for you again. The left side's the leg that moves first. And then it was my left side that was actually limited. So this happens a lot when we're in projects together. I'm just going to throw this back up. So a lot of times we do some projects either at work or at school. I'm not really sure what age level I'm talking to, but if you're in a work environment, sometimes what happens is one person is overloaded with too much work, and then there's other people that are slacking. Now, out of those two groups, who's the one that complains? It's not the one that's having the free ride. It's the one that's actually doing all of the work, feels overworked, and that's the same thing with our body. So in my case, when my left hip extension, so my ability to lift my leg off the table wasn't working, my right side had to overcompensate and work extra hard. So sometimes that happens when we have these chronic issues where it's like, oh, I've had this shoulder thing forever, and I've had every treatment that I can think of and it's just not working. But then all of a sudden we realize it's actually coming from your left hip. And that's the cool thing about M.A.T, because we can take a wider look at what's going on with the body and the mechanics to figure out what is putting the stress on that shoulder for complaining. So it's the same thing in a work environment where if one person's complaining and they're stressed, well, if we just fired him, but he was the only one doing all the work, the whole thing is going to crumble. So we want to go reassess, see who's doing their job, who isn't doing their job. And what M.A.T does is actually finds the muscles that aren't working properly and gets them doing their job, so the person that's stressed can relax and just work on their job. So how does that get done? Because that's more of a complicated question. So same thing when your car breaks down, we want to jump cable it. That's kind of what we're going to do here with M.A.T. So I have two images here on the screen. The bigger picture is a little bit more of a simple version. The smaller one is a little bit more complex because our bodies are super complex. But what happens is when we contract a muscle, our muscle's attached at 2 points. So we're going to take our bicep, because the bicep in the PowerPoint. So our muscle for our bicep is attached up here to our shoulder and then down here on our forearm. So I want you to picture a string. When this string contracts, it can only bring those two bones closer together. So I can't straighten my elbow with that. I can't shrug my shoulder with it. All I can do is bring those 2 points closer together, just talking about the bicep. The way that the bicep does this is that our muscle fibers, they contract, so they get smaller. And when that happens, that squeezes. Now, when we have some kind of input, it will either tell our brain to contract more or there'll be no signal. So an example of that is if you pick up a box but you have no idea how much it weighs. If you pick up a heavy box, your body knows how to respond. It needs to respond with more force. If it's an empty box, your body also knows how to respond. We need less force so that we don't throw it out of our hands. The reason why it does that is because the muscle spindles, I don't know if my cursor can show here, but on the smaller picture, there's like a little muscle fiber, and then you can see there's coils in there. So when those coils change size, that's what actually sends the feedback up to the brain. So if you have a heavier box, then that coil gets more load onto it. It sends more information to the brain to say to contract more. So this is where muscle activation comes into play. We actually press on it, because if you press on a coil, it also changes length. And this allows us to manage the system. What I mean by that is finding the guy who's slacking off in the group project and bringing him back into his role. Now, the reason why that gets impeded is because of too much stress or trauma. So that could be an accident. It could be dehydration. It could be over-exercise, because when we exercise, we're actually causing damage to the tissue, which we're hoping recovers and becomes better, but sometimes it doesn't recover, and then you're not able to communicate as efficiently. So that's where muscle activation comes in. So first, we check the range of motion. Once we find the limit in range, which for me was hip extension, then what we do is a bunch of muscle testing. So I'm going to pull my video back up here. So this is sped up because our sessions are usually an hour here. But what Stu is doing to me right now is he's going to each muscle that would contribute to that hip extension in order to allow that movement to happen. So what's happening is that we know all the muscles that contract to bring that leg up. We're doing a muscle test and then doing a muscle palpation, and that's what jump starts it. So again, like I said, that coil that's inside that muscle, when we put pressure on it and we apply it to an action, we're reprogramming the brain. Hey, brain, this muscle is really good at this action. Start using this one instead of another muscle. So this is very, very sped up, but that is what Stu is doing right now, is he's actually treating that hip extension. And then we'll watch the after in a second here. So you can see from the before and after, the hip extension is a lot better. And then afterwards, what I noticed when I went for a run is that my right hip wasn't bothering me. So the most important takeaway from that is that, again, that check engine light that comes up in your car, it doesn't mean that that light isn't working because it showed you something's wrong with it. We have to look at the entire car and figure out where in that car is there an issue where that little signal is coming up. And so we do that through watching your range of motion, watching from one side of the body to the other, always comparing you to you. So I'm not comparing you to a textbook saying you need a certain amount of degree of neck rotation. But if you can only turn this much on one side and this much on the other side, that's an issue. So once we've identified a range of motion issue, then in my brain, I'm calculating which muscles help you make that motion happen. And then we reprogramming it, getting the brain to communicate to the right tissue that allows for that motion to happen. And then we go back, recheck the range of motion. Now there's two things we're checking for. Does the range of motion get better? Yes or no? And then the second thing is whatever you came in saying wasn't working right, whether it was pain, stiffness, or you didn't like your mobility, did that improve with that? That's what we're looking for. So with muscle activation, it is very, very specific because it is meant to reprogram movement or motor patterns. It doesn't necessarily help with acute injuries or help with neurological issues. So something, for example, like Parkinson's or MS, where that's actually changing the neurological communication from the brain to the muscle, M.A.T doesn't help with that. What it helps with is someone that's already healthy, that had, lived life, got a few bumps and bruises, and now that has accumulated and caused you to have chronic tightness or stiffness and just doesn't feel like you move very well. So the other thing that I brought today too was this client here came in and he was very nice to share a testimonial, but I wanted to hear, what does it feel like after your first session? How does that feel? So this individual, he actually ended up breaking his ankle in an accident. And he was getting frustrated because he just felt like he had hit a plateau in his treatment process. His physio was doing an amazing job, but just hit a plateau. And then when I actually treated him, I realized that it had nothing to do with his ankle. Because his right hip wasn't working properly, it was actually crashing down on his ankle, undoing all that hard work that the physio was working on. So what was nice is when we used physio with M.A.T, we were able to progress him faster because now his body's not crashing down on his foot constantly, just undoing all the progress that he was making. So I'll let this guy kind of talk about his experience.
I don't think the audio was working, Sarah.
Oh, no, it's too quiet?
Yeah.
Okay. I don't know how to change my volume on there.
I can see on the bottom right, there's a little speaker. I wonder if that has.
Is that 100% though?
Let's see. There's another little speaker on the bottom right in the black. I wonder if that has, yep, that's 100% as well.
Okay, I'm actually going to pull it up on my phone and then just play it from my phone for you guys.
Perfect.
Because the audio should be better. While we do this, great time to throw in some questions into the chat box, because it might take me a second or two just to find his video. All right, actually, I found it already.
I had my first treatment last week.
Is that audio better?
Yes.
Just in my mobility and my strength, and having a lasting effect on from day to day. I've noticed with my rehab process, trying to strengthen this and getting mobility, it only lasts for so long during the day. It's like hours. Whereas when I'm here and I work with Sarah, this guy was able to last me 5 or 6 days, and I was able to engage in exercises where I normally wouldn't have. It would be more of a modified exercise. So yeah, I think overall it's been a great experience, and I'm gonna have to continue to do it because of what I feel.
So I don't know if you could hear that or not, but what he was saying is he would feel good after his physio, but then after 2 to 3 days of relief, it started to come back again. And again, that has nothing to do with the physio. The physio was doing an amazing job, but he's walking on his foot. And every time he was taking that step, because his right hip wasn't working, he was crashing down onto that ankle, and it wasn't allowing him to progress that the way that he wanted to. And he also noticed that he could actually start progressing into harder exercises once we created that stability. So the best example I can give for that is that if we had a bridge and we kept seeing cracks in the foundation and we just kept filling them in, but we never looked above to see that the guy wires weren't doing their job to support the bridge, it's always going to crash down onto those pillars and they're going to have to work a lot harder. And so that was what was happening with this individual, was that he was doing everything right for that ankle, but we had to take a step back to be like, hey, well, what else is happening with this person's body that could be impeding the way that they're actually progressing with their treatment. So yeah, we'll go back to the PowerPoint here. So this was the first slide that I showed you guys on kind of what M.A.T is. So 1, we check that range of motion. 2, we do the muscle test to see specifically which muscles are doing their jobs properly. If they're not, we reactivate them. We reactivate them by the palpations. That's step 3. And then afterwards, we recheck to see what we're looking for. Did it make that change? Afterwards, in order to kind of like solidify that, then we give some more exercises. So I always say it's like me giving you a phone number. If you never use the phone number again, you're going to forget it. So we have to teach the brain, how does it use it? And then how can we load it depending on what your lifestyle is? Because it's very different if you just want to do it for, walking 100 meters versus like you want to go downhill skiing, right? So that's going to be a lot more force on the tissue, and we need to make sure that that tolerance level of that tissue can meet what your daily request is from your body. So that brings me to this slide here. What kind of car are you? Because that also depends on the treatment plan that you want, right? So if you're a car that goes hard and fast, you got to make sure that you're having those treatments more regularly, just like a Formula One car would stop with those pit stops more regularly to make sure that it's being maintained and that it doesn't break down while the driver's driving it. It's the same thing with our bodies. Not only does it depend on what you want, what your lifestyle looks like, what your daily activities look like, but then it matters like what kind of car are you? What are you actually designed for? So that's really important too, because A lot of people think that you'll get one treatment and then you're done, but I actually use it as depending on how much stress is in my life, on how often do I want this treatment to keep me going. So for example, if I was getting ready for like a backpacking trip or something like that, where I'm increasing the stress on my system through exercise, I want to make sure that my body's adapting to it properly and catching those signals early enough that I'm not setting myself up for injury. So that's muscle activation in a nutshell, but I would love to hear from you guys on questions. What brought you guys here? What was any questions that you wanted to answer for M.A.T? I can definitely answer those.
Thank you, Sarah. I actually have a question. It kind of refers back to what M.A.T is for versus what it's not for. So if somebody experiences, say, tingling or numbness in their hands or their feet, is M.A.T, say during movement or even during sleep, is M.A.T something that works to improve that, or is is it not something that M.A.T improves?
Yeah, so yeah, any pain sensation like that, whether it be tingling or something more aggressive like pain, that's just that check engine light. So at that point, I don't even know if it's muscular. So it could be. So let's say, for an example, you're getting tingling in your hands and you really notice it when you're riding your bike. That's the only time that you feel it. Well, what could be happening is that as you're riding, you're compensating and maybe using your traps, putting pressure onto the nerves, and it could make your hands tingling. That's option number one, right? Another thing is that it's got nothing to do with muscular stuff. Maybe there's something to do with the nerve itself, and maybe the nerve's entrapped. That's not something that M.A.T would cover. If you needed to decipher between the two, one is like, usually people have tried other treatments before they seek something else like muscle activation. So usually most clients that I've seen has actually ruled that out already. But I always do free meet and greets too, because I want to make sure that I'm the right fit, because M.A.T will only help with that muscle's ability to contract. If there's actually something that's pinching that nerve, I won't be able to help with that.
Okay.
Yeah.
Thank you for that. We do have another question. The question goes, I'll read it as it was written. Does M.A.T start with a full body analysis to find hidden troubles, or does it look at specific symptoms?
No, it looks at full body. It doesn't matter where your pain is. I need to see everything from your toe all the way up to your head and neck. Just like the individual that gave the testimonial, if I didn't look at full body and I only looked at his foot, we would have never been able to help him.
Okay.
Yeah, great question.
So along those lines, I've been over to see you folks a couple of times. I live in Radium, so it's not the most convenient place to get to. And so I've got a whole bunch of exercises which I'm doing a lot of every day, morning and night. And if anything, it's increasing my symptoms.
Yeah.
And like I'll get a massage and it'll break up the knots in my lower legs. And 6 hours later, I got the knot back there.
Yeah. So you brought up a great point, David, and Radium's a beautiful place. I'm kind of jealous that you're out there. So how the brain is communicating to the muscle tissue, if it's compensating, that compensation is actually going to get larger. So the stronger muscles are going to get stronger, the weaker muscles are going to get weaker. So that's why those exercises feel like they're failing you. And I went through the same thing through my injury, was like, oh, you got to just do, these ab exercises. But because my brain wasn't understanding which muscles to use, I was actually making that compensation pattern even larger, and I was setting myself back with my progress. Now, massage is awesome. I'm going to describe the difference between massage and M.A.T. So I don't know if you have any kids or if you have any siblings.
No,
but
I live by myself. I'm primarily, today I did 16 kilometers cross country and 800 meters. That's an easy day for me.
Okay, so super active, which is amazing. The analogy that I'm going to use though is just if you know what kids are like, sometimes the older child wants to do everything for the younger child. So what massage does is it takes the older kid away and it hopes that the younger kid figures out what to do. So what I mean by that is it takes away the muscle that's overactive, but doesn't necessarily teach the underactive muscle how to do its job. What M.A.T does is it goes to the kid and says, hey, this is what you should be doing, and get them to start working for you. So to answer your question, why would I have a massage 6 hours later, it would come back? is because the muscles that are underutilized still don't know what their role is in that
Yeah.
movement pattern.
Yeah.
And so that's why, you know, every modality kind of hits a little bit differently. And that's how M.A.T. is different, where it actually goes to the muscle that isn't contracting, isn't helping you, you know, do your 16-mile walks or hikes or cross-country skiing, or sorry, cross-country running.
No, I'm a climber.
Oh, climber. Awesome. So yeah, you're not recruiting those correct muscles in order to get that done.
Yeah. Yeah. Because in the process, I've noticed over the last few months in particular, the ankles seem to be getting stiffer.
Absolutely.
And yesterday, driving back from Calgary, I was noticing glute med was all of a sudden firing. And I mean, I'm doing exercises that it's like crazy to strengthen up my glute muscles. And you know, that's still firing.
Yeah, and some muscles obviously are firing. Like, you know, we've got 500 muscles, so we've got some muscles that are firing. The question is, are they firing for the right job? That's the biggest thing.
Yeah.
Yeah.
Yeah, it's really hard to know whether M.A.T. will do much for me. That's the trouble.
Fair enough. And that's actually why I did the meet and greets, the free meet and greets. I was so sick and tired of going from practitioner to practitioner and it not being the right fit for me. And so that's why I've always offered that, because it's frustrating for a client, but it's also frustrating for me as a practitioner if it's not the right skill set for what's wrong with the person.
Thank you for the question. We have a few more.
Yeah.
How does M.A.T. help with hip surgery recovery, or does it?
Yes, it does actually. So hip surgery, so like I said, any kind of stress or trauma to the tissue is what stops the brain from communicating to the muscle tissue properly. So what M.A.T. does is it makes sure that, well, surgery is a little bit complicated too, because we've actually cut through the tissue and cut through the nerves, but we'll go and stimulate the muscles that are around there so that we can help improve the mechanics of that. But we can also see any other compensations that are going on with that so that we can offload it. So again, with that guy with the ankle, so we took the pressure off of the hip so that the hip wasn't crashing down on the foot. We'll just make sure that your trunk and your hips and your calves are all working properly to take that load off the hip so it can heal a lot faster. And a good analogy for that is if you've ever moved, if you move by yourself, it's a big daunting task. If you move with 500 of your friends, it becomes fun. It's very easy and the job is done fast. It's the same thing with our body. When you have that kind of stress and trauma, we've taken people out of that equation to help you move. So the more muscle power, the more movers that we have in your body, the easier it is for you to move, the easier it is for our body to repair itself.
Great. Thanks for that great explanation. I think this may be a very similar question. Does M.A.T. help with osteoarthritis of the knees?
Yeah, very different question and very good question. So where do I want to start with that? So that's actually changing the bony structure of your bone. So that we can't do anything about. However, we can help with how you're moving. So when I was going through for my master's for M.A.T., I actually helped someone in Oklahoma. We took 1,000 random people off the street who were not in pain and we x-rayed them because we wanted to see what their x-rays were like, because the only people who get x-rayed are people in pain. And what we realized is that these 1,000 random people that were not in pain had the same thing, had the osteoporosis, had bony spurs, had bulged discs, but yet they weren't in pain. So what was the difference? And the difference is, does the brain safely have a solution for that movement pattern? So a great example for this is if you wake up and you got to go to the washroom, but you have the bathroom, there's no panic. Imagine in a very public place with no washroom around, how panicked you get, super panicked. Same thing with our bodies. So if our brain understands that the muscles can support our joint and move it safely, that alarm bell isn't there anymore. So even though we can't necessarily change what is going on at the bone level, we can actually help with the muscles around it. So the other example I can give is that I broke my back when I was little. That's what the injury was. And for what structurally is happening back there, I can't change any of that. But when I was 17, I couldn't touch the ground, and now it's effortless. And I can still flare my back if I want to, but it takes a lot more for me to flare it. Whereas before, any little thing completely put me into bed for the next day. So it's the same thing with the osteoporosis, same thing with my back. There are certain elements that we cannot change, but if we can get the brain to understand that it's moving safely, those alarm bells of the pain starts to dissipate.
Okay, great. Thank you for that one, Sarah.
Yeah.
One more question, and I think it's more related to sciatic. So sciatic nerve problems, someone's had back issues for years and now is having sciatic issues. Can M.A.T help with that?
Yeah, so sciatic is a beast by itself because it's an irritated nerve, right? So we have a nerve that runs through our back, down into the hip bone and down into the bottom of our foot. And when that becomes irritated and inflamed, it's kind of like when we have we've bitten on our cheek, we just want to keep biting it because it's just a little bit more inflamed and bigger. So with M.A.T and sciatic by its like just together by itself, I wouldn't say that it's the most effective treatment for that. But if you're monitoring, especially with chiro, to make sure that the hips are aligned, we can make sure that the muscles around it are supporting it to take pressure off the sciatic. Another thing that's really important too is nerve flossing. That's very easy to YouTube, and you can try that. You can just say nerve flossing sciatic, go very slowly with that, but see if that even gives some relief to just how intense that is.
Okay, thank you. I may have spoke wrong. I'm not sure. It was the above, and I apologize if I did. The above question asked about osteoarthritis, not osteoporosis.
Oh, okay.
Would the same answer, would it be the same from the answer that you had given?
Yes. So osteoporosis is loss of bone density. Osteoarthritis is actually inflammation in that bony joint. Yes, it will help with both of those. But you are correct. There are two completely separate things happening with that on the bone level, but it's the same thing with my back, right? My back has nothing to do with the bone itself deteriorating. It has those fracture lines in it, and the way that they kind of grew back together is just in an awkward position.
And sorry about that mix up. There's another question. Is there an average amount of sessions that people come in? Like, would they come in, say, for 6 sessions to help a sore hip, or is it kind of 1 session at a time or a monthly session? What would the treatment plan typically look like?
That matters on a whole bunch of different factors. It's kind of like if you came to me and said, hey, I want to do a marathon in 6 weeks, I'll be like, okay, well, have you done a marathon before? Like, where are you at in your fitness? So it depends on a bunch of different factors, and it depends what you want to get out of it. Like, do you just want to get it so that you can raise your hand over your arm, or do you want it so that you can go like David, go for these crazy climbs, right? So you're going to be recruiting a lot more from your body. So with that being said, for me, I'm a lifer. Like I try to go as much as I can. So if I'm in maintenance phase, I go once every 2 months. If I'm getting ready for a big race or a big adventure, I try to go at least once a month just to make sure my body is going well. And then if I have something that's kind of ailing me, I'll try to go maybe twice a month to get that done. Very, very rarely would I see someone every week. That normally doesn't happen unless we're kind of trying to be very aggressive just to kind of start out. The way that I do all my sessions, though, is that you do 2 1-hour sessions with me 1 week apart. And what that allows me to see is how fast are you progressing? And then I'll ask you, what are your goals? Because if you come in and say, hey, my hip's bothering me and I've got a race in 6 weeks, I want to see you a lot more frequently so that we can get you ready for that race, versus someone's like, okay, like I've got all the time in the world, but I just want to start making this progress as I'm also working at the gym in order to progress my exercises. So hopefully that answers your question.
Great. Thank you for all these great questions. I love the interaction. It really helps on the presentation side. Would you agree, Sarah?
Yeah, absolutely.
Yeah. Are there any further questions? I don't see any popping up. Now, I see you have listed where you are working, and I want to clarify that. Sarah, so you may notice moving forward with active sports therapy that we have 2 locations. Sarah is with Willow Park, Active Sports Therapy Willow Park, and she will be taking appointments. Are you there full time, Sarah?
Tuesday to Friday, but yeah, full time.
Full time. And what was the other thing I wanted to add? Oh, yes. If you're wanting to kind of go over some of this lecture and review any of it, there'll be a follow-up email coming in your mailbox, probably within about the next 36 hours. that you'll be able to view if you have any kind of thoughts going, oh, let's go back and learn about that particular thing. I want to thank Sarah for a great informative session. Oh, one thing did pop up about cost. Now, is that a front desk thing, Sarah? Is that something that
I can go over the costs.
okay.
Yeah. Before I go over the costs, just in case people are starting to trickle out, that's okay too. If you ever want to contact me, my Instagram's up there and my email is up there. Please feel free to reach out. My Instagram's nice because I've got quick little 30-second clips of kind of what is M.A.T. There's some more testimonials as well, so you can kind of get a more of a feel of what muscle activation actually is. And as far as costs go, so the upfront cost is for those 2 1-hour sessions. So you see me one week and then you see me the following week. Together, that's $180 plus GST. Follow-up sessions for the 50 minutes are $110 or $70 for the half-hour sessions. When is it appropriate for half-hour versus 50? I'll definitely walk you through that when I've seen you. There's a bunch of different factors on that. If your body's super sensitive, sometimes you can't handle 50 minutes. It's too much stress on the system. 25 minutes is also perfect for kids that are under the age of 16 because their nervous system hasn't fully developed. And then sometimes if there's like just little minor things that we're kind of working on, 25-minute sessions seem to be appropriate for that as well. And that's the cost for all that.
Okay, great. Thank you. Another question popped up. Is there complementary treatments that work well with M.A.T? Like,
depends what,
yeah.
Depends what the issue is, and 100%. I like working with other people. So we have 11 different systems in our body. So it really depends, like, what's the issue with the tissue. I always say that I need a shirt that says that line. So depending on where that stress is starting from, that's going to be definitely where you're going to have the most amount of progress. So for an example with that, right, if it's the way that the brain isn't communicating to the muscle, sending that alarm bell, M.A.T is going to be a perfect fit for that. The person that said about the sciatic, right? If we can figure out a way to reduce the inflammation off of that nerve, that's going to show them the most amount of progression. What M.A.T does, especially with when you're seeing other modalities, is I find that it's not really the glue. I just find that it really prolongs when you need to see me and somebody else. So for example, when a chiropractor works on you and gets all the bones in line, well, that's great. But if there's a muscle imbalance, it's going to pull that alignment out of place. So if you do chiro with M.A.T, then all of a sudden you don't need to see both of us as much because you've got the alignment of the bone. I make sure that you hold that alignment and then you don't need to see us as much. Or same thing with the physio, right? So that individual was seeing physio on a weekly basis at that point. And so when we were able to work with him, now he doesn't need to do physio as often. He doesn't need to see me as often because now he's just progressing faster. But with those 11 systems, I mean, if you're getting more checked off, it's just making sure that everything that has been affected by it is being taken care of.
Okay, great. Thank you once again for your time and attention this evening. Sarah, you've been fantastic answering questions and giving us lots of information. Stay tuned for more from Sarah, I would imagine. I don't want to commit to anything specific, but she's definitely one to watch on social media at the Dynamism. I knew I was going to mess that up. .ca. It is a pretty interactive channel with lots of great information that will that I personally enjoy watching, and I think you guys will as well. There will be upcoming lectures and workshops this month and in June that are not related to M.A.T, and then we're taking a break for the summer. But we look forward to seeing everybody soon, whether it be in the clinic or at these lectures. And thanks you once again for your time, and thanks for the great workshop, Sarah.
Yeah, thanks for joining me. And if there's anything that you want me to cover in a lecture or a workshop, let me know.
Yes, that's excellent. There is a feedback form that will be coming in the email within the next 36 hours. And that's a great spot to let us know what you want to know from us, and we're here. Yeah, thanks for that, Sarah.
Yeah.
Have a great evening. Thankfully, it's not raining for a moment, and wishing everybody the best.
Thank you, Sarah.
Yeah, thanks for watching. Bye.
Bye.